We're continuing our conversation on COVID-19 this morning as a first-of-its-kind new report by the peer-reviewed journal The Lancet says mental health issues were magnified by the pandemic. The report stipulates that an additional 53 million cases of major depressive disorder and 76 million cases of anxiety disorders were caused by COVID, casting a new light on just how dire the consequences of the global pandemic can be for those infected and, yes, even those that are not infected. Pediatric psychologist Dr. Ann-Louise Lockhart joins us now with her take on this new report. Thank you so much for joining us. Dr. Lockhart, the report unfortunately also says that younger people were the hardest hit by COVID when it comes to their mental health. Can you talk a little bit about that population's vulnerability and why they're so susceptible to mental health issues?
Thank you for having me, Stephanie. Yeah, as I've seen in the course of this pandemic, the last 18 months, what has happened is the significant isolation. I really believe that with our physical distancing, social distancing, which was meant to keep us safe, what it does is that it takes a toll on our mental health. We are not meant to operate in isolation. We're not meant to operate apart from other people. We are social beings. So a lot of the anxiety, the depression that we saw was really due to people not being in their social circles and their social groups. And frankly, children are social. A lot of their life is spent in developing in a setting, in a school setting with other people besides just their family. And so, I agree. I see a lot of this taking a toll because of the isolation that we've seen and kids being out of school for a time and maybe not even seeing their friends for a long period of time.
And that makes a lot of sense. The same way that adults were dealing with isolation and depression. Of course, children are little human, so of course they would possibly deal with the same thing. What are some of the signs that we should look out for when it comes to kids, and just what should we look out for to figure out if they are having some mental health issues?
Yeah, that's a great question. That is a question I got a lot from parents. I think one of the first things that we want to pay attention to is a shift in their personality. If your child, your teenager typically operates in a certain way and you see a slow or rapid decline into a different kind of kid, so maybe you had a teenager who was very social, always liked getting together and texting and talking to their friends, and now they're spending all their time online or all their time in their room and not wanting to connect with friends and making excuses, I would say really pay attention to personality shifts. If there's changes in their mood, they're more irritable, more agitated, more on edge, and they don't feel like they want to engage. I think we so often pay attention to sadness when it comes to adults, but with teenagers, with kids, we often see more sassiness, more argumentativeness, irritability, agitation. They appear mad, they appear on edge, and really pay attention to that. Another big one, though, is if they've lost interest in things they used to enjoy. So they used to love doing sports, or they used to love going out and playing outside, or they loved, playing an instrument, and all of a sudden they don't have an interest in that. I would say that loss of interest is very important because that's showing, again, a shift in functioning and a shifting personality. And then paying attention to sleep, changes in appetite, changes in focus and concentration, and then grades.
We must keep a close eye on those kiddos. And as we move forward with a potential vaccine for kids, will that have a positive impact on children's mental health?
Well, I think in a way it can have a more positive impact because it can lead to more peace of mind for a lot of parents. I think parents who are deciding to do vaccinations for their children, they'll feel maybe more comfortable that their kids are protected, their family is protected, and they can do more things maybe without masks. Maybe they could do things with masks and the vaccine, but really looking at whatever direction that we're given by the CDC and looking at what is safe for our region based on cases. I think it'll give people more peace of mind. They'll feel more free, and they'll feel like they can move about the world and do things that maybe they were missing out on doing. And I think that'll have a really positive impact for a lot of families.
Dr. Lockhart, thank you so much for your insight. We appreciate your time.
Thank you, Stephanie.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.